Good day to all my viewers. Today I'll speak about the antiretroviral therapy. One of the most important aspects of the treatment of HIV/AIDS is the counseling. Is the second important part is improving the nutrition of the patient, and the third important is the antiretroviral therapy. So, what exactly is this antiretroviral therapy? In the 1990s, somewhere in the middle 1990s, single drug antiretroviral therapy started. So these drugs, they reduce the viral load, they stop the viral replication, the spread of the virus. They don't kill the virus. So please make a distinction that it is not a curative treatment, it is only controlling the spread of the virus. Initially, single drug like zidovudine was started, and later on in the early 2000s, there were other drugs which were started like NRTS and NRTS, and now we are giving multiple drug option, a single dose but with three drugs. Now, where exactly is what are the indications for this antiretroviral therapy in a HIV/AIDS patient? The first indication is whenever a patient comes to the ICTC center, and after the due counseling, if he or she is tested HIV positive, he or she are counseled by the counselor regarding all the aspects of the disease, how it spreads, and what precautions have to be taken to prevent the spread. And then he is referred to the physician for evaluation and starting of the ART. What has changed in the last 10 to 15 years in the ART treatment is, irrespective of the staging of the disease and the CD4 count, the ART is started to every patient who is tested HIV positive. The logic behind this is to reduce the viral load so that his or her quality of life improves and he can do routine activities like any other person. So that is the biggest advancement we have seen. The second indication is when a patient is come to the antenatal OP, she is pregnant and she is tested HIV positive. Irrespective of a stage of the disease, irrespective of a CD4 count, ART is started. This is called prevention of parent-to-child transmission of the virus. So that it has got a double advantage. The patient is controlled with the HIV, and the HIV/AIDS does not spread to the unborn child. That is the advantage of taking antiretroviral drugs in a pregnant lady, and she has to take lifelong for her own good. The third indication is when a service provider like a surgeon or a physician or a lab technician or a staff nurse is accidentally gets a prick with a HIV/AIDS positive blood needle during surgical procedures or any other procedures, during drawing of blood or any other surgical procedure, major or minor, this is called post-exposure prophylaxis. So the area is cleaned with the soap and water, and the person is given 1 month of antiretroviral 3 drug therapy. This eliminates the risk of HIV coming through the needles. The risk is around 0.3 to 0.4%, but this is a very, very important intervention. The fourth indication is when one of the partners, suppose we have got a male and a female, one of the partners is HIV positive, the other is negative. The negative partner can take ART medicines, either 3 drugs, single dose, or now there is a drug called lenacapavir, every 6 months one injection, so that he or she does not get the virus from his or her partner. So this is a very new advancement. This is called pre-exposure prophylaxis for all patients who are at high risk of getting the disease. So now that you can see the importance of antiretroviral therapy in improving the lifestyle, the quality of life, ensuring that all these patients don't get any opportunistic infection. Why it is important to take this drug regularly is most of them they suffer from, otherwise they will get tuberculosis and any other fungal and bacterial infections because their immunity is reduced. So a patient of HIV/AIDS dies not with the HIV/AIDS virus but with the opportunistic infections. The advantage of taking ART is that these opportunistic infections like tuberculosis, that is pulmonary and extrapulmonary, the risk is almost zero, and other fungal infections like meningitis and other bacterial infections like pneumonia is almost reduced to zero because of regular intake of the ART drugs. So that is the most important thing one should know. So to my patients, my advice is be regular and be consistent and continuous in taking the ART drugs to improve your nutrition and immunity by taking good diet as prescribed by the nutritionist or by the physician. So take a high protein diet so that your immunity is improved and these drugs will act in preventing the opportunistic infections. And third is be consistent with the drug. So compliance, that is called drug compliance. So if a patient is not taking ART drugs for some time, then he or she, the CD4 will drop and he will get a recurrence of the disease. So in essence, what I should say is ART has revolutionized the treatment of HIV/AIDS. Now it has become in like any other non-communicable disease like hypertension or diabetes or metabolic syndrome, and the patient can have his or her own normal activities. He can do his normal jobs without any hindrance. A patient who aspires to become pregnant can become pregnant and bear one or two children with ART drugs. Accidental exposure also, you need not worry about the risk of getting HIV. And when there is a discordance between the partners also, one of the partners can be free of HIV with these drugs. So this is all about the ART drugs. And one more thing I want to tell you in the last is there is something called a drug resistance. If a patient is not improving with the routine ART drugs, there are some centers of excellence where there is a resistance pattern of the drug is seen and the patient is given drugs which act. So in essence, be compliant with these drugs and then try to improve your quality of life and be happy. Thank you very much.